just kind of fill people in. When did you graduate from SCNM?
Graduated Southwest College in Naturopathic Medicine in 1997. I was the second class to graduate from the school.
Fantastic. And after graduation, what do you think was your greatest challenge?
My greatest challenge was setting up a specialty practice. I was always and only interested in the care of people with cancer, and so oncology was a natural fit for me. I think the greatest challenge was putting together that when you're starting out and you're a new physician and you're trying to build a practice and you decrease the available the patients that you can see because you're trying to form a specialty practice. It becomes difficult, but it was in my heart to do so, and I knew that it was the right thing to do. That was my greatest challenge. I had a challenge while I was in school, and I was always convinced that to be a good physician I needed to know as much as I could about the field of medicine. I consider myself a doctor first and a naturopathic doctor second. I see us as specialists. We're specialists in naturopathic medicine. I see myself as actually a subspecialist, as a naturopathic oncologist. Doctor first, naturopathic doctor second, naturopathic oncologist third. So part of my challenge in school was getting education that I wanted to within the hospital system. I felt that, especially given my interest, that I know that patients go to the hospital. They see conventional physicians, and I needed to seek seeing patients in that context as well. So there was a challenge in getting rotational hours through MD or DO colleague offices. It was overcome through persistence.
Okay.
But I was the first naturopathic physician to rotate through county hospital as well.
Wow.
At the end of that 2-week rotation, I gave to the entire interns included, students included, emergency department a lecture on what is naturopathic medicine, and the school then adopted that as a general slideshow that they use for marketing, I believe, and some of that is still alive today.
Wow. When did you choose to follow in this specialty?
When did I choose?
Well, yeah, was it prior to going to school, or?
Absolutely not. I can't pinpoint when I chose it or it chose me, but it was something that captured my interest because of my love for the pathways in medicine, understanding the biochemistry and the molecular aspects of the cell, and how that fits into anatomy and general physiology and endocrinology, etc. And I think oncology held for me both the beauty and the mystery of the human body, seeing it, how long we've come as a general medical professional as a whole, but how far yet we have to go to understand the intricate workings of the human body. And to me, only oncology holds that and keeps me, and will and should keep me continually interested in the field. Okay.
Can you pinpoint, or was there a specific incident that led you to medicine?
Yeah, it wasn't a specific, but there was a journey there, and I'd be happy to talk about it.
Mm-hmm.
I graduated after having difficulty finding my major from the University of Iowa in 1991 with a BA in philosophy. Existential philosophy is a subgroup of that, and really didn't have exact direction on how to use a philosophy degree. Part of me thought I was going to become an instruction manual writer because of my love for argumentation and developing a philosophy and an argument therein. I soon found myself interested in the sport of triathlon, and through that began working at a health food store. And as I was working there as an employee and helping people pick items, etc., I would study. And I became intrigued as to why these items were helping people, both from dietary perspective as well as specific supplementation aspects. And I was introduced to the field of naturopathic medicine by an MD. His name's Philip Lansky, and he was working in Iowa City where I was working. His offices were there. His offices were adjacent to the health food store, and he would often prescribe out of our health food store. It's called Whole Earth. When I went into Dr. Lansky's office and was invited in, he had an entire wall, a single row of homeopathic remedies. And he had an entire closet full of Chinese herbs as an MD. And it fascinated me. And he saw that I was interested in how and why people were getting better, and he saw that I might be interested in medicine, and he said, there's this thing called naturopathic medicine. And he showed me a thumbnail ad in the East-West Journal in 1992 that Southwest College of Naturopathic Medicine had taken out before they actually opened their doors to students. And that was how I found my way.
Wow. Now that your practice is established, what do you think the future holds for you?
For me, the future holds something globally. There's no question in my mind that we will expand and bring naturopathic oncology globally, to the world as a whole. It is my belief that people all over the world should and need to have access to naturopathic oncology medical services.
Excellent. Where do you think the profession is going, the naturopathic profession?
The profession of naturopathic medicine, it is absolutely clear to me that the profession of naturopathic medicine is and should be and will be a profession unto itself and needs not wait for anybody else to accept it. We are who the world has been looking for their medical care. We are a main voice in the choir of medical services needed by this country. And without us, I think medicine as a whole will not be as good as it could be with us.
And do you have any advice for people who might be interested in becoming a naturopath?
My advice is to follow your heart. If it is what you believe in, naturopathic medicine is governed by philosophy and precepts. And these are precepts and philosophies that need to be felt and tended to and revisited. And naturopathic medicine is not for the individual who's not interested in constantly becoming a better physician, because it is within the essence of naturopathic medicine and our physicians to do so. As we revere what I talked about, the beauty and the mystery of the human body, it is central to the philosophy of naturopathic medicine. And so I encourage everybody to explore their feelings and to research naturopathic medicine, because it's much more than just a business and needs to be looked at as such.